Okay, hello everyone. So in today's session, we will gonna discuss about a one-liner topics which is related to obstetrical and gynecology. It will be a rapid revision kind of video. So I want you people to just listen it carefully. Okay, this session will be in Hindi and as well as in English. So let's start the session. First of all, first question or first line is which antibody crosses the placenta? So IgG is the only which crosses the placenta, and you should have this knowledge. And if you talk about which immunoglobulin is present in the breast milk, that is IgA. Now, the hormone that prevents menstruation and maintain pregnancy, dear, एक प्रेगनेंसी को मेंटेन करने के लिए by sustaining the function of corpus luteum is around this HCG is important. Okay, in the fetus skull the bregma is found at the junction of sagittal coronal and the ventral suture. Okay, abnormal proliferation of uterine, you can say endometrium is known as endometriosis. So endometriosis is a see, just you ignore this arrow, it's just a pointer kind of thing. Okay, so एंडोमेट्रियोसिस क्या होता है बेटा? एंडोमेट्रियोसिस जब यूट्राइन की inner layer will get proliferated and all, that is known as endometriosis. Okay, the next liner, contraceptive pills helps in the birth control. So how does a contraceptive pill कैसे काम करता है? ये प्रिवेंट करता है ओवुलेशन से. ओके, विद ओवुलेशन वी वांट LH जो 14 डे पे LH सर्ज होता है, देन ओवुलेशन. सो दिस काइंड ऑफ थिंग, ovulation is prevented by having OCPs and all. Okay, next topic. So I have also put some distracted in between the slide. So till now what we have studied in the first slide, that to maintain a pregnancy, dear. Okay, so HCG is very important till starting trimesters and all. It's to maintain the inner lining of the bed. And then the last topic what we study, innermost metriosis. Okay, let's move to the next session. So in the next session, I will be, let's have a discussion here. Okay. So, now we're going to discuss regarding about the uterus height and all. Talking about the uterus height, okay, so if this is the uterus, at this week, it is around 24. So many books and video channels say different thing, but it is 24 weeks of gestation, okay, at the point of the umbilicus and all. At 8 weeks, if we talk about the size of the uterus is like the grapes. It's like a grapes, okay. Relationship of the fetus head and limbs to its trunk is known as a attitude. इसको attitude बोलते हैं. What is exactly a attitude? The attitude एक baby का head में is of good flexion. It should be like this. The neck should not be extended like this. Okay, it should be flexed like this. So इसका meaning क्या है कि relationship of the head, fetal head and the limbs to its trunk. कि like the baby is like completely is like this. So this is complete flexion. Okay, this is known as the attitude of a baby. Next, the operation which is done in the uterine prolapse, there's a gynecological problem that is known as a uterine prolapse. उसमें कौन सी surgery करते हैं? That is Fothegal operation. Okay, एक operation का नाम है. It can come as an exam point. You should know this. Okay, let's move to the next slide. Okay, so dear, let's talk about the infertility and all. So inability to conceive consistent attempts for 1 year. For example, a couple is there and they're not able to conceive in spite 1 year is completed without any kind of contraceptive. So this is known as infertility. That is known as infertility. Whereas we are having two things. We are having a primary infertility and we are having a secondary infertility. दो type का infertility होता है. तो primary जो infertility होता है वो couples है जिन्होंने कभी they've never had a baby. Whereas the person who are having a secondary infertility, dear, means they had conceived, but now the mother is not able. Once they have conceived, but now they are not able to conceive. Maybe because of the secondary infection. So till now we studied about the infertility. It can be a primary, never conceive, and the secondary, once they are conceived, and next time they are not able to conceive. Now Most common of secondary fertility infertility is the PCOS is the one of the important cause है जो secondary infertility करता है. Now, what is oxytocin hormone works? कैसे काम करता है ऑक्सीटोसिन हार्मोन? सी, ऑक्सीटोसिन जो हार्मोन होता है डियर, इट आल्सो हेल्प्स इन द लेट डाउन रिफ्लेक्स. लेट डाउन रिफ्लेक्स में हेल्प करता है. ओके, यूट्राइन कॉन्ट्रैक्शन स्टार्टिंग वीक्स में, like at the end of trimester it helps in uterine contraction and all. Okay, and also the oxytocin is responsible for the milk ejection. Always remember, oxytocin do not have a role in the production of milk. It has a kind of kinetic production, a really kinetic kind of like in the mammary gland, if there's a milk, so it squeezes the mammary gland so that the milk can be ejected. Next. So let's talk about the prolactin. Prolactin hormone, what is the function? बेटा prolactin जो है एक ऐसा हार्मोन है जो मिल्क प्रोडक्शन में हेल्प करता है, प्रोड्यूसिंग. So now we have two concepts. We are having oxytocin, milk ejection, and production. The prolactin hormone is responsible. So lactogenesis, that process of formation of milk is known as a lactogenesis. Okay. Or always remember, prolactin has a two role. One is the milk production, that is known as a lactogenesis, and one is to maintain that milk production throughout the time period. That is known as a galactopoietic hormone. मतलब वो prolactin maintain कर रहा है production of milk, that is galactopoietic hormone. Okay. Now, next session. So, okay, again, I have put a distracted in this slide. So let's have a recall. In the previous slide, we had a discussion related to infertility. We are having a primary infertility. We are having a secondary infertility here. So, the primary fertility means they have never ever conceived. In the secondary infertility, they have conceived at once, but now they're not able to conceive there. Okay. That is known as a secondary infertility. And then we just had a discussion related to the two hormones. One was oxytocin and other was the prolactin hormone of milk. For the production, we have prolactin. Is that clear? So again, recall the things which we have studied in the previous. I have a discussion. Next, we will gonna have a discussion here. So let's talk about the android pelvis. How does the android pelvis look like? It is a kind of heart shape. So, as at a viewpoint of exam viewpoint, so they can ask you about different shape of the pelvis and which of the pelvis is gonna be adequate pelvis. Okay, so this is a heart shape. Now that how this is very important. Now we will have a discussion related to what are the different placenta separation site. So we are having a placenta over here. So after delivery, there should be some 3 to 4 signs which tells you ki exactly the placenta has been separated. First of all, there will be gush of blood. You will gonna see a gush of blood. Like after delivery of the baby, gush of blood will be there. That sign will represent that placenta is separated. Second thing, there will be lengthening of cord. For example, this is the uterus and this is the cord, and you are standing somewhere here. So this cord will slowly will be lengthened up without any kind of like pulling force. So that these two are the main signs. Other signs are also there. You will gonna see a fundal notching, fundus papo notching दिखेगी. Okay, next. Next we will have a discussion here. So these were the placenta supply. Let's talk about the placenta. I already told. Let's talk about some color changes. So discoloration of the anterior vaginal wall. What is the name? This kind of changes is seen around 6 to 8 weeks and all. That is known as your Chadwick sign. Okay, why a patient is having a Chadwick sign? Because during pregnancy there is an increase in blood circulation to that area and the vascularity is increased. So Chadwick sign. Okay, now next disease that pass from the so some diseases directly pass from the parents to the offspring with the help of the placenta. That kind of transmission is known as a vertical. We are having different type of transmission, vertical, horizontal. The vertical transmission captures. Okay, now first puberty sign is female is thelage. Okay, thelage means it happens in female, and the breast development, the word is known as thelage. Most common cause of vaginitis. This is very important. Okay, तो Gardnerella vaginalis is the causative agent जो vaginitis cause करती है. Okay, Gardnerella vaginitis. Okay, so in the previous slide, till now we had a discussion regarding what do you think? What we have discussed in the last slide. So in the last slide, we have studied about what is the causative agent of vaginitis here, and we just had a discussion regarding placenta suppression sign. The placenta suppression sign we're studying about the three thing which we're gonna see: gush of blood, lengthening of the cord will be there. Okay, and fundal notching is there. Okay, now let's move to the next slide. So these areas are important, and if you talk about in OBG, these questions are frequently asked. Next, organism responsible for lactational mastitis. So mother will gonna complain कि मुझे बहुत ही पेन हो रहा है, इन्फेक्शन है. तो वो कौन सा ऑर्गेनिज्म है? वो है स्टेफाइलोकोकस ऑरिस. दिस ऑर्गेनिज्म लाइक बहुत बार ये बहुत ही इंपॉर्टेंट है, स्टेफाइलोकोकस ऑरिस व्हिच कॉजेस इन्फेक्शन. नाउ रूल्स यूज्ड टू कैलकुलेट जेस्टेशन, आपको पता होगा. We are using a Neagle's formula for the calculation of LMP and ETT. So how you will gonna calculate 9 months plus 7 days. ये आपको गलत नहीं. Which is the most kind of epizotomy which is used, that is your medial lateral. RMLE आप देखोगे, ठीक है. राइट मीडियल लेटर बहुत ही कॉमन एपिसोड में है. एंड ऑल्सो वन मोर थिंग आई वांट टू ऐड कि डियर प्रूडेंटल नर्व ब्लॉक होता है वहां पे जब हम वजाइनल डिलीवरी करते हैं, पेशेंट्स का प्रूडेंटल नर्व ब्लॉक करते हैं लिग्नोकेन इंजेक्शन से. ओके, एंड यू शुड नो अबाउट दैट नाउ. ओके, now, okay, let's talk about the stages of labor. Here, the line is we are having a first stage here, and the first stage we are having a word which is known as a latent phase. So, when you will gonna say a latent phase, when the cervical dilatation is from 1 to 3, that is known as a latent phase. Now, what you will tell the patient to do at that time, we will gonna educate the patient to walk, ambulate, position change, and comfort measures. We have to focus on that. So, these are the major focus area of breathing relaxation and all. Next, we are having active phase. तो बेटा फर्स्ट स्टेज होता क्या है? If I will ask you what is first stage, from the true labor pain till 10 centimeter dilation, that is known as a first stage of labor. से first stage of labor कहते हैं. Now active phase क्या होता है? 4 to 7 सेंटीमीटर की ओर जाने वाली उसको हम एक्टिव फेज कहते हैं. ओके, इसके दौरान हम पेशेंट को बोलते हैं काम क्वाइट के लिए, स्लो ब्रीदिंग के लिए बोलते हैं, पोजीशन चेंज एंड ऑल. हम वी कैन गिव अ बैक मसाज टू द पेशेंट. ठीक है, पेन हो रहा है, एनाल्जेस. सी एनाल्जेसियस वी डू नॉट प्रिफर, can have a problem on the newborn, so we don't prefer that. Then we have a transition phase from 8 to 10. So अभी तक हमने पढ़ा latent phase, then we have studied about the active phase, and then we studied about the transition phase. Okay. जब 10 centimeter होता है, then we cannot tell the patient to move, complete bed rest and pattern space breathing. So this is very important area of like for example pattern space breathing. कौन से stages of labor में बोलते हैं? It only we educate the patient activities in the this transition phase. Okay, so this was the next move further. Okay, now this is very important, that is known as a DAMPA injections and all. DAMPA, DMPA, depot medroxyprogesterone acetate. Okay, so DAMPA injections is a kind of contraceptive. This is an injection which you will wanna see in PSC CHCs. Okay, it is given at every 3 months to the patient. It is an injection. Okay, and it is given as IM. And in government of India supplied free. उसको कौन से name से आता है? Antra. So this is the image of Dampa injection, जिसे Antra. So in your question, it can come कि what is the name by which government of India says, or you can say Antra is the main thing. Antra means Dampa injection. Okay, Saheli. Saheli का नाम भी है. Okay, so this is also known as Centrocom. ओके, सहेली है. अब पूछा जाएगा नॉन हार्मोनल कॉन्ट्रासेप्टिव पिल, दैट इज सहेली. ओके, लेट्स टॉक. सहेली को हम ओरो रोमेलोसिक्फेन के नाम से भी कहते हैं. or you can say it is a particular selective estrogen receptor modulator. Okay, next question. Next, we will talk about the submental vertical diameter here. Okay, that is a 9.5. Okay, now by which week the uterus height is at umbilicus? 24 weeks alone. Okay, next question. So these are only आपको जो ये लो arrow दिख रहा है ये just एक pointer है, does not mean decrease. Okay, next, what is Spalding sign? Spalding sign आपको क्या लगता है कौन से केस में आप देखोगे? What do you think? Spalding sign here is usually seen in a patient baby who is IUD. Intrauterine that हो गया तो particular you can see the feature Spalding sign is present in IUD cases and all. So here what happened, the cranial bones overlap due to the liquefaction of, this is known as Spalding sign, which is seen in the baby with IUD, overlapping cranial sutures and all. Let's move further. Signs of placental separation, I already told you. Third stage of labor. वो क्या होता है dear? From the childbirth till the past placenta separation and all, that is said to be third stage. हमेशा याद रखिए third stage 30 मिनट से ज्यादा अगर होता है तो then we will go with the MROP, that is known as a manual removal of placenta. ठीक है, ये सब आपको पता होना चाहिए. MROP. now now next is about, next is the line which is known as process by which the cervix becomes thin like of the uterus. तो इस ये कौन सी चीज है बेटा, इसको बोलते हैं इफेसमेंट. वी कॉल इट एज इफेसमेंट. इफ आई विल आस्क यू व्हाट इज इफेसमेंट, दैट इज थिनिंग ऑफ सर्विक्स. सर्विक्स जितना पतला होता है दैट इज नोन एज अ इफेसमेंट. ऑलवेज रिमेंबर इफेसमेंट इज प्रेजेंटेड बाय परसेंटेज, उसे परसेंटेज से रिफ्लेक्स करते हैं. तो 50%, 100%, तो 100% इफेस्ड है, दैट मीन्स अ गुड थिंग. नाउ द बेबी can be delivered and it's time for the delivery. Okay, next slide. दैट इज इफेसमेंट. नेक्स्ट, सेकेंड स्टेज क्या होता है डियर? ठीक है, जब फुल डायलेशन से बेबी आउट को हम सेकेंड स्टेज कहते हैं. ओके नाउ, okay now during intrauterine time the majority of testicles descend into the scrotum by which week? 28 weeks में बेबी का जो टेस्टिकल है वो डिसेंट हो जाता है. So these are one liner only read. In active phase, what is the speed of cervical dilation in multipara? It's around 0.5 centimeter per hour. Okay, so what is the average duration? Okay, primary gravida में 1 centimeter per hour. Okay, okay. So till now what we have discussed, the main thing हमने अभी पढ़ा डंपा इंजेक्शन के बारे में पढ़ा है. Okay, we have studied about this is a distractor. I already told you. Let's recall fast. तो हमने अभी डंपा इंजेक्शन पढ़ा है. एंड इन डंपा इंजेक्शन के बाद हमने सहेली के बारे में अंतरा. ओके, इट्स अंतरा. और सहेली हमने देखा उसको सेंट्रोकोम के फेसमेंट एंड वेरियस स्टेजेस ही आउट होता है. तो वी कैन गो फॉर द, लेट्स सी फर्दर. अब हम बात करते हैं विच टर्म इज यूज्ड टू डिस्क्राइब थिनिंग एंड शॉर्टिंग ऑफ सर्विक्स. ये मैंने आपको पहले ही बोला था कि थिनिंग मतलब इफेसमेंट. ओके, सहेली कॉन्ट्रासेप्टिव क्या है, वो लखनऊ से डेवलप हुआ था. CDRS गवर्नमेंट डेवलप बाय द सेंट्रल ड्रग रिसर्च सेंटर ने. ओके, LNG 1.5 mg का होता है. हाँ, स्टॉल वर्दी साइन, वेरी वेरी इंपॉर्टेंट, स्टॉल वर्दी साइन. ठीक है, तो आपको स्टॉल वर्दी साइन यू विल गोना सी इन केस ऑफ प्लासेंटा प्रीविया. प्लासेंटा प्रीविया क्या होता है, जब लो लाइन प्लासेंटा होता है. ओके, तो वहां पे आपको स्टॉल वर्दी साइन दिखेगा. बहुत सारे साइंस होते हैं OBG में जो जानना बहुत जरूरी है. एग्जैक्टली, लेट्स मूव फर्दर. Okay, again, bluish discoloration is known as a Chadwick sign. Okay, okay, anemia मुक्त भारत कैंपेन. डोज ऑफ IFA कितना देते डियर? 65 mg elemental iron, 500 microgram of folic acid. LMPDD, I already told you how to calculate. Okay, very important. We are having intrauterine that is copper T, कुछ एक 5 years का होता है. That is copper T 375 is for 5 years. Okay, then we are having copper T 380A, that is known as for the 10 years. One more thing I want to tell you, what you think why we have given the names like 380 and 375, what does it reflect? I say 375 dear, that means कि इतना जो कॉपर वायर है वो उस कॉपर में इतना यू कैन से स्टेयर, बट 380 में अलग उतना अमाउंट ऑफ कॉपर है. नेक्स्ट टाइम यू शुड ऑलवेज रिमेम्बर कि जो letter say does not represent the year of development. It just represents the amount of copper which is there in the copper tea. Okay, let's go further. 380A is for 10 years. Okay. Okay, next is very important. Okay, cleaning of diabetes dear, it's only done at a 24 to 28 weeks पे ही करते हैं OGTT test. So I can ask you a question when OGTT test is done, you have to reply at the 24 to 28 weeks and all. PPC IU series मतलब immediate after delivery हम कॉपर्टी पेशेंट को इंसर्ट करते हैं. That is known as a PPC IU series. Okay. Now, normal amount of amniotic fluid, देखिए एक you can say at term pregnancy we are having 1 liter of amniotic fluid. If a patient is having amniotic fluid which is less than 200 ml, that is known as a oligohydramnios. And if a patient is having more than 2 liter, 2 liters से ज़्यादा है amniotic fluid, then that client is known as having polyhydramnios. So you should not be having any doubt. So this was a short session. Okay, so thank you so much, dear, and don't forget to like this video. Thank you so much.